Good morning to the OI warriors, the caregivers, the clinicians, the physicians, and everybody else involved in keeping us healthy and having a great day. Today, we're going to wrap up our 5-part slideshow on some of the most serious side effects, non-skeletal related, with osteogenesis imperfecta, wrapping it up with cardio. On number 9, congenital heart defects. These are less common, but they do seem to be overrepresented, meaning they don't show up as often unless you stop to compare the OI patient to the average person, in which what they've found is congenital heart defects were identified in 13% of the OI patients that have been studied. Most commonly are the arterial septal defect, with the PDA cardiovascular findings, including arterial septal defects, have been reported in OI, along with valvular insufficiency and aortic root dilation, both of which we talked about earlier. Some examples to watch out for are the ASD, that's the arterial septic defect, and the PDA, the patent ductus arteriosus. These are most commonly reported in the moderate to severe pediatric OI patients. Recent pediatrics data found congenital defects in about 13% of one particular group of OI patients. Again, when you're looking at 1 in 10,000 to start with, and now more than 10% of those start off with some heart issues, you got to watch that. Number 10, of course, is cardiopulmonary strain. This is something that is, I think, over talked about and yet under addressed. It's one of the easiest to miss because it often starts with the lungs and the rib cage. In moderate to severe OI, you'll find a chest wall deformity. I used to always tell folks that my breathing wasn't real good because I'd broken my ribs so many times I never really learned to take deep breaths. Then I found out some folks had some serious torso issues. Scoliosis, this is something I have not had to deal with myself, but as I'm sure you can imagine, if you just picture scoliosis or a patient with scoliosis, it compresses lung capacity. Restrictive lung disease can place chronic strain on the right side of the heart. Symptoms for those are going to be shortness of breath, reduced endurance, dizziness, fatigue. The issue is increasingly discussed because the morbidity and mortality in OI strongly are linked to cardiovascular and pulmonary interactions, not just the bone issues. Now, we've covered a lot here the past couple of weeks. And to be honest with you, if I had to prioritize the 5 big items to watch for, I would look for, number 1, the mitral valve regurgitation. Number 2, the aortic valve regurgitation. 3, the aortic root enlargement. 4, atrial fibrillation and palpitations. And number 5, and this is the one that my doctor is always climbing on, is high blood pressure. Why? Because these are the ones that are repeatedly reported. These are more easily detected, and potentially they are more manageable. Unfortunately, they also quietly get worse as time progresses, or the effects of them get worse. You're putting more and more strain on your system. I, for example, take several different blood pressure medicines. And when I walked in to see one of my doctors the other day, he looked down and looked at me and said, I almost wet myself looking at your blood pressure. It's like, Doc, I'm taking everything. I'm eating properly. I'm just telling you. I don't want to say it's normal because I don't want to normalize it. But if you come in and you say, I have OI, it should be immediately followed by, which of course, means I have high blood pressure. If you have a new physician that you're interviewing or somebody's seeing you in the ER or what have you, it will help decrease some of the sense of emergency. I won't tell you what my average daily blood pressure is, but if I were to be seen in an ER situation and that was what they read, they'd have a bad day. and they would start pumping me full of drugs that for a little while would make it better. Again, these are just some of the things to look for. We can't cover everything. I could cut this up into 200 different parts and we wouldn't be able to cover everything.